cranial cavity, meninges, dural venous sinuses, and cranial nerves. Here are the objectives for review. So after completion of today's lab, you should be able to define the bones of the cranium and prominent landmarks on the internal surface of the skull base. You should be able to identify the foramina in the skull and the structures that are traversing them. You should be able to identify the major blood vessels of the brain, identify dural venous sinuses and trace the flow of blood within them, and identify the cranial nerves on the brain itself and their courses through the skull base. So now, with the brains removed, you should be able to identify without any trouble some of your dural infoldings, starting off with the biggest one, which is your cerebral falx, the falx cerebri. Then you have the little tent over the cerebellum, the cerebellar tentorium. The tentorial notch is the hole in the cerebellar tentorium that allows for passage of the brainstem. And then you have a really small one, the cerebellar falx. Now let's turn our attention to the dural infoldings and dural venous sinuses. Let's remember that we have two layers of dura that will separate in several locations. This is where the dural venous sinuses are formed. And the function of the dural sinuses is to collect venous blood from the brain and conduct it out of the cranial cavity. First of all, let's try to recreate and reposition the dura so that we can see what it would actually look like in real life, so we get a little better picture of its 3D morphology. And then we can identify some of the structures that are actually formed by it, which would be the biggest one here is your superior sagittal sinus. Starts anteriorly close to the crista galli and goes posteriorly all the way along here until it actually then empties into the confluence of sinuses. Next, here's your inferior sagittal sinus, which runs in the margin of the falx cerebri, that then empties into the straight sinus, which then in itself also goes into the confluence of sinuses. Here is a vein called the great cerebral vein, which also connects to the straight sinus. Then you have transverse sinuses, which are going, well, this one you can see, it goes to the left away from us, which then continues as the sigmoid sinus, sigmoid because they're S-shaped. And the last bit is then the internal jugular vein. To review this part of the dissection, we will need an atlas. We will start off with reviewing the infoldings of the dura and getting a good three-dimensional appreciation of how they're arranged. Next, we will name all the venous structures that you would encounter if you were a droplet of blood stemming from three different origins. Okay, the first origin would be from a cerebral vein all the way to the internal jugular vein. The second would actually be from the sphenoparietal sinus all the way to the sigmoid sinus. The third would be from the great cerebral vein all the way to the internal jugular vein. We will not study the brain in detail in this course. We know that brain anatomy is a specialty that is reserved for neuroscientists, and so the descriptions that will be provided here are just intended to relate some of the major features that we can appreciate on the external surface of the brain, and we can relate those to parts of the skull that we will definitely be studying in this dissection. Okay, and as an additional goal of the study, we want to see if we can establish a mental picture of the continuity of the arteries and nerves of the brain with those same structures that are actually left behind in the cranial fossa after we take the brain out. So, just to keep it simple, and we will see these in lecture as well, we have a couple of structures on the external surface of the brain here. We have our frontal lobe, we have a central sulcus, which is right here, we have a parietal lobe, we have our temporal lobe, our occipital lobe, and then we have our little brain here, the cerebellum, and here the brainstem. And we can relate these to the different cranial fossae, which would be the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. If we now relate some of the major features on the external surface of the brain to our cranial fossae, we should be able to see that the frontal lobe is associated with the anterior cranial fossa down here. The temporal lobe is associated with the middle cranial fossa. The cerebellum would be located in the posterior cranial fossa, back here, and the occipital lobe is located superior to the cerebellar tentorium, right here, and the brainstem actually becomes continuous with the cervical part of the spinal cord at this big hole, which is the foramen magnum. If we continue looking at the gross anatomy of the brain and the external features, let's have a brief look at some of the arteries here. We should recognize our vertebral arteries. We've seen them earlier on when we're dealing with the root of the neck. Vertebral arteries give off a few branches before then actually joining forces forming the basilar artery, which gives off a couple of branches. They're all in your dissectors, by the way. Gives off a few branches here before then, with help of a communicating artery, which is here called the posterior communicating artery, communicates with the internal carotid artery. And then from here we have the anterior communicating artery, which forms an arch that connects the internal carotids, and then moving anteriorly we have the anterior cerebral artery. So basically what we have is a big arterial circle that is formed, which is also called the arterial circle of Willis. So if we have a look at the cranial nerves, 1 through 12, number 1 is the olfactory, 2 optic, connected by the optic chiasm, 3 oculomotor, 4 trochlear, 5 trigeminal, 6 abducent, 7 is the facial, 8 is the vestibulocochlear. Used to be called the auditory, now it's vestibulocochlear. Number 9, glossopharyngeal, 10 the vagus, 11 is the spinal accessory nerve, and 12 is the hypoglossal. Dissection review here is pretty intuitive, so let's review some of the parts of the brain and the cranial fossae where you can find them, review the infoldings of the dura mater and how they relate to the cerebral hemispheres and the cerebellum, and also review the formation of the cerebral arterial circle. It's called the circle of Willis as well. There's some more details about that in the dissector. I only mentioned it very briefly, but there are more components to it, and there's also information about that in your books that are the required literature for this course. And then last but not least, recall the origins of the internal carotid artery and the vertebral arteries, and what is the route that they have to use to reach the cranial cavity to then in the end be able to communicate with each other. Now we're going to have a look at the cranial fossae. This is the overview of the dissection. We're first going to review, of course, once again the bones that form the floor of the cranial cavity and also the boundaries between the cranial fossae, and then we're going to study all the vessels and nerves in each cranial fossa. Especially important is going to be to know where each of them exit the cranial fossa. One thing to mention here is, well, we have dura covering the floor of the cranial cavity, and so the dissection is going to be much easier if we actually hold a skull beside our specimen during the dissection, so we could actually have a direct observation of all the foramina. And then I'll leave the review of all the bony features here up to you. We've gone through some of these previously already, so here are some of the bolded terms from the dissector, and here's the picture, figure 749 from the dissector, so you can review some of the structures. And this is the continuation of the structures that are found in the skeleton of the cranial base. So let's start now in the anterior cranial fossa, and best thing is to start with removing the dura. Okay, so you'll use a probe to loosen the dura where it's been cut along the edge of the frontal bone. Okay, then you grasp it with your fingers and pull it posteriorly as far as the lesser wing of the sphenoid bone, and then you can actually use scissors or your scalpel to detach it along the sphenoidal crest and along the midline, and then you can put it in the tissue container. And what you should have done now is you should be able to see the lumen of the sphenoparietal venous sinus, because that is actually located all the way along the sphenoidal crest. Now we'll continue reflecting the dura, so you will grab it along the sphenoidal crest, and I'm going to peel it back as far as the superior border of the petrous part of the temporal bone. So take a skull to get a reference for this so that you know where all those parts are, and refer to the images in the dissector. And then also note that the middle meningeal artery is right here, and it'll adhere to the external surface of the dura. Okay, so use a probe and try and tease the proximal part of the MMA away from the dura so that it actually remains in the skull. It's really important that you have this later on, that you can see your middle meningeal artery come through the foramen spinosum and then branch into your anterior and posterior branches. Okay, And then you can also go ahead and detach the dura, which you've now pulled backwards, pulled posteriorly, and you can detach it along the superior border of the petrous part of the temporal bone, and you can also put that in the tissue container. Because only once we've removed all of the dura can you actually see all of these structures below it. Now, having removed the dura, we should be able to see our cranial nerves pretty well, which would be cranial nerve number 3, number 4, V1, and 6. And of these nerves, 3 of them, 3, 4, and V1, are actually going to go through the lateral wall of the cavernous sinus. Here's your cavernous sinus. And so here's number 3, here's number 4, and here's V1. And if you have a look at this here, these are a little more protected than the abducent nerve, which is really closely related to the internal carotid artery. So if you now put this in context with the possibility of an infection in the cavernous sinus, you may imagine that the abducent nerve, if this also involves the internal carotid artery, might be the one that is affected quickest. And as the abducent nerve has to do with our extraocular muscles, you might think that it might be an idea to test some of these if the abducent nerve actually still works. If we now have a look at the posterior cranial fossa, that contains the cerebellum and the brainstem, and we will be able to see our facial nerve, cranial nerve number 7, and the vestibulocochlear nerve, which is cranial nerve number 8, and they both will enter the internal acoustic meatus. And then we can see our glossopharyngeal nerve number 9, and the vagus nerve number 10, and the accessory nerve number 11. They all enter the jugular foramen. Then, last but not least, we have the hypoglossal nerve, which enters the hypoglossal canal. The dissection review of this important part of the lab includes, of course, some osteology, review of the bones that form the floor of the cranial cavity again, read something about the dural venous sinuses and review them on your dissections. Also, you should be able to summarize the cranial nerves and review their course, and also name the opening through which each of them pass to exit the cranial cavity. And if you just have the dry skull, also review the openings here, all the foramina and fissures through which you will actually see cranial nerves pass. And if you have a brain available, hold it right next to the cranial cavity so you can actually see its ventral surface, and you should actually be able to see where the cranial nerves actually come off the brain and where they would have attached to the severed vessels and nerves that are actually remaining in the cranial cavity. Here I have a link to some dissection videos, first as usual from the University of Wisconsin, and then I have one here from the University of Michigan. That's actually the lab video. There's scalp, cranial cavity, meninges, and brain.